about the purpose here, and then we'll talk about how you're going to swab your throat. So basically we're going to do the exact same thing that you would have done to you if they suspected you had strep throat. So if you went into your doctor's office or a clinic and they asked about good old throat culture, that's basically what we're going to do. What they're swabbing for is they want to see if you have a bacterial infection, and we're starting to get stingier about that because we don't want to just hand out antibiotics if you're complaining about a sore throat. Like, we have to know if it's actually strep. So that's why my purpose is this Streptococcus, because the bacteria that causes strep throat is actually in that genus called Streptococcus. So it kind of makes sense, Streptococcus. So anyways, I'm going to switch to basically the handout. We're going to use the handout kind of like as a guide. And then I just want to kind of point you in the right direction so you know where to swab. Then I'll show you guys a short little video for doing it. So they have kind of like a zoomed up picture of the back of the throat. So one of the critical things is this. We are going to give you a tongue depressor. We don't call it tongue blade, but a tongue depressor to help you to get your tongue out of the way. So the important thing is that we don't want your tongue. We don't want to swab your tongue. We're not interested in the bacteria on your tongue. So they tell you it is better if you push down towards the back of the tongue, make sure that that's clear out of the way so we can get back to the throat. We also don't want to swab, so it says be careful not to touch the teeth, cheek, gums, tongue. Like, basically we want to avoid the whole mouth and tongue area. So same thing when you go in for your doctor for the throat culture, the nurse will go straight back to the throat, right? And then the not so fun part is number 4, they say the throat should be swabbed, not gently touched. We'll do the best we can. I will do the best we can with getting a good swab. But if you look at the picture, so they're trying to show you the tonsils are like in the lower corners if you didn't get them removed. If you have your tonsils still, they're kind of like in the lower corners. You have on both sides of the back of your throat. And then there's actually like that little uvula, which is that piece of tissue that kind of droops down the back of your throat. So when I show you guys the video, basically what she tells you to do is to try to do your best to pick one tonsil or the other, so it doesn't matter, but you actually want to get your swab and you want to brush from that tonsil all the way to the uvula and all the way to the other side. So it's kind of like a horseshoe, like a whoosh. And she does it really fast, so you'll see it in the video. But yeah, so if you can get in there and kind of go left to right or right to left as fast as you can. Let me bring this up. I know you guys are like, that's hilarious. I don't know about that. Let me switch to all right. So it's a little hard to see at the beginning, but then you can kind of make it out here. All right.
So the first thing you want to do if you're doing a throat culture is to open your swab. Make sure you don't touch the tip of it on anything. Have the patient open their mouth. It helps best if they look a little bit upward so that you can see the angle closely. And then let's take a look at our anatomy. In adults, we talk about the tonsils, but we're really talking about the tonsillar pillars and the uvula. And your job is to go up the first pillar, usually the patient's right side, across the uvula and touch the second pillar on the left before you come out. And you can usually do this all in one gap. So you go up, across the uvula, and down the other side. So you want to come up the right pillar, across the uvula, and down the second.
Wait, I want to watch this one.
So chlamydia. We need to actually get.
All right. All right. So that's she does it pretty quickly. So we'll just do the best we can. All right. So for materials, we actually don't need much. All right. So each person basically just needs one blood agar plate. I would say in like a hospital lab, blood agar is probably one of the main media that they use a lot because it's got a lot of nutrients in it, so they tend to be conservative and just go with the blood. And then what else? Oh, just one sterile swab. And then it's up to you if you think the tongue depressor will kind of help to get the tongue out of the way. Sometimes the tongue depressor makes people gag, so whatever's better for you, that can be like an optional one. But the tongue depressors, they've all been autoclaved, so they're all sterile. And then you guys are finally going to learn how to streaking technique. All right, because we mentioned this like in the very beginning of the semester, that for whenever they swab from patients, a lot of times they streak. So we're going to think of our plate as like quadrants. So quadrant 1 is going to work like this. It doesn't matter if you want to go clockwise or counterclockwise. Just pick a direction and keep going. So for quadrant 1, you're going to use your loop. Not your loop, sorry. You're going to use your cotton swab. So, let's say you successfully swabbed your throat with minimal gag reflex, right? You're going to use your cotton swab and then go ahead and streak out quadrant 1. All right, what I mean by streak is you'll just follow my pattern. So I'm going to go left to right, 1, 2, 3, 4. And you notice that I have it as like, 4 distinct lines. Like in other words, I'm not going like this with my swab. I'm just drawing out, I'm just tracing out the 4 lines, left to right. And then that's it. So you're just gonna trace over my pattern like that. You know, it doesn't have to be a ton of space in between, but just make sure there's a little bit of space. So we don't want the lines like stacked on top of each other. And then when we're done with that, you're done. You can just throw out your swab in biohazard. We don't need the swab anymore. We don't need the tongue depressor anymore. We're going to go on to quadrant 2. So when we streak, it's a pretty strategic way of kind of mapping out your organism along your plate. In quadrant 2, you're going to flame your loop. We're going to switch to the loop. Fire up the Bunsen burners, flame it, and then you are going to intersect quadrant 1 and streak out quadrant 2. So what I mean by intersect is you're basically going to kind of cross over into quadrant 1, and you're going to overlap it and kind of drag it out this way. So as long as you have that little bit of overlap, then you're fine. So basically what you're doing with your loop is you're like grabbing the bacteria from quadrant 1 and you're dragging it out into quadrant 2. Then we're going to do quadrant 3. Quadrant 3 is going to be the same thing. You're going to reflame your loop. Reflame your loop. You're going to intersect not quadrant 1, but quadrant 2, if that makes sense, and streak out quadrant 3. So we're going to dip into quadrant 2, which would be this one, and kind of drag it out this way. So I'm always just going into the one before, right, the one previous. And then finally, we're going to do quadrant 4. Quadrant 4, same thing, reflame your loop, let it cool down, and we're going to intersect, or like dip into quadrant 3. So I'm going to go into here, kind of drag out this way. I'm going to stop short so that I don't bump into quadrant 1, if that makes sense. So I have like a little gap there. So we're gonna have the 4 so that's our full streaking pattern. Then when you're done, don't forget, so you don't have to reflame your loop. Just go ahead and you're going to use basically like the edge of your loop and you're going to stab the plate. So you are going to stab, quadrant 1 and go ahead and stab those empty areas. So I'll do this in, what is it, maybe like a blue marker. So you're basically going to use like the edge of your loop and you're actually going to sink it in there. You're going to kind of sink it in and jab it, give it a couple stabs there, and then you'll sink it in maybe a couple spots over here where there's no streak pattern on there. And then that's it. When you guys are done, we have some tape up here, I guess because we consider you guys biohazard. So we'll tape the edges and then we'll put them in the incubator. They'll still go upside down. They'll be in there for 48 hours.